we're going to perform the oral hygiene on an unconscious patient. Now, why do we need to perform oral hygiene on the unconscious patient? The purpose is to prevent from halitosis, to maintain the integrity of the lips, gums, and teeth, to stimulate salivation, to prevent tooth decay. Now, the articles we're going to require for the oral hygiene are gauze pieces, some cotton balls, emollient, MSS basin, sterile gloves, saline water, KMNO4 solution with the concentration of 0.01%. In the sterile tray, we have artery forceps, thumb forceps, mouth cap, and a tongue depressor. And next thing we're gonna need is a cotton towel and the Macintosh. We're gonna use the Macintosh and we will spread it under the head of the patient, head and neck of the patient. Now we're going to use the MSS basin and we're going to put it under the mouth of the patient so that any fluid that comes out of the patient just spills into the MSS basin. Now we're going to wash our hands and we're going to put on the gloves. The patient is unconscious. Now we're going to use the mouth gag to put under in the patient's mouth so that the mouth doesn't get closed. Artery forceps and we have the gauze piece. We're going to take the gauze piece and we're going to surround it. Now we're going to dip this padded gauze piece in the KMNO4 solution. We're going to take the thumb so that it doesn't dribble in the patient's mouth. Clean the mouth of the patient one-sided thoroughly, upper and lower side of the teeth, from gums to the crown. Remember you have to use the gauze piece, one for the one-sided of the teeth, and now put it inside another MSS basin. We have prepared the another gauze piece for another side of the teeth. Now we're going to perform the oral hygiene for another side. Since the patient is unconscious, its tongue would have been falling backwards, so we're going to hold the tongue with the tongue depressor and dip it inside the KMNO4 solution. Use the tongue depressor and clean the tongue thoroughly. Dispose it off in another MSS basin. Now we're going to use the normal saline water. And we're going to clean it, the teeth, inside the teeth, dispose it off, dip another in the saline water, use it for another side of teeth, clean the teeth thoroughly, clean the tongue as well. And now we are done. Now we have to remove the mouth gag from the patient. Wipe the face of the patient. Tell the patient that we have done the oral procedure and now we're going to take the artery forceps and some emollient. Emollient is used for lubrication of the lips to prevent the lips from crackling. Dip it inside and put it gently on the lips of the patient. Now we're done with the procedure and now we're going to document everything we have done.